Hello. Supervised community treatment was introduced in 2008 as part of the Mental Health Act 2007 amendments, allowing community treatment orders to be imposed in certain circumstances. The effect of this is that patients who no longer need to be treated in hospital can be treated in the community while still under the powers of the Mental Health Act. This means that they can be discharged from hospital earlier. Community treatment orders are intended to prevent relapse and the harm that relapse can cause. The patients are subject to certain restrictions and can be recalled to hospital under certain conditions for up to 72 hours. The Cto can be revoked at this time and the patient remain in hospital under the Mental Health Act. I'm Dr Beth Colby, a psychiatrist in London. I will first talk about the process of placing a patient on a Cto, including the criteria that the patient must meet and the conditions that a Cto. I will then look at how long a Cto lasts and how this can be extended or stopped, the ways a patient can appeal against the Cto, recall of the patient to hospital, and the revocation of a Cto. If the patient is under a treatment section of the Mental Health Act, including Section 3 and Section 37, and a few other sections that aren't used that often, and is being considered for leave from the hospital for more than 7 days, the responsible clinician is required to consider a community treatment order for that patient. The community treatment order comes under supervised community treatment, and Section 17A is the form the responsible clinician and the approved mental health professional need to complete prior to a patient being discharged under a Cto. If the responsible clinician, who is usually a consultant psychiatrist, considers that treatment in hospital is not a major part of the patient's treatment, he or she must either place the patient under a Cto or discharge the patient from their section and hospital. If it is the opinion of the responsible clinician and the approved mental health professional that the patient is likely to stop their medication and not be seen for follow-up with psychiatric professionals when they leave hospital, or their mental health deteriorate, they will be placed on a Cto. The conditions the patient is subject to are for the purpose of ensuring that the patient receives medical treatment and avoids relapse, or to prevent the risk of harm to themselves or others. These form part of the Cto, which the responsible clinician must put in writing. The patient must meet certain criteria, and the approved mental health professional needs to put in writing that these criteria are met and that the Cto is appropriate for that patient. An approved mental health professional is a professional approved by the local social services authority and has a variety of functions within the Mental Health Act and has been specially trained to decide whether a patient needs to remain in hospital under the Mental Health Act. If the approved mental health professional, I'll call him or her an AMP now for ease, does not agree with the responsible clinician that the patient should go on a community treatment order, this cannot proceed. Carers and the nearest relative should also be involved in the planning of the process, although the nearest relative cannot object to the Cto and may not be told before a Cto is made. The care coordinator is a mental health professional who coordinates the care of the patient in the community, and the GP must be informed that any potential change in the prescribed psychotropic or psychiatric medication will need to be discussed by the responsible clinician in order for the responsible clinician to issue a certificate, which is called Cto 12, for the patient outlining their medication, or make arrangements for the medication to be reviewed by a second opinion appointed doctor. Now on to the criteria that a patient must meet. The patient must need medical treatment for their mental disorder, for their own health, safety, or for protection of others. It must be possible for the patient to receive the treatment they need without having to be in hospital, provided that the patient can be recalled to hospital as necessary. When deciding if it is necessary to recall the patient to hospital, the responsible clinician must consider the risk that the patient's condition will deteriorate after discharge from hospital as a result, for example, of refusing or neglecting the treatment that they need. In considering that risk, the responsible clinician must have regard for the history of the patient's disorder and any other relevant factors. Patients who are subject to a CTO are referred in the legislation as community patients. CTOs must specify conditions that the patient is required to adhere to. There are two mandatory conditions for all patients. The first is that the patient must be available for medical examination for the purpose of extending the CTO. And the second is to make themselves available for the second opinion appointed doctor to see them regarding consent to medication. Other conditions must be necessary to ensure that the patient receives their medical treatment or to prevent harm to the patient's health, safety, or the safety of others. The responsible clinician and AMP must both agree to the conditions, and these must be in writing. The responsible clinician may vary the conditions which are not mandatory or may suspend any of them. Now on to how long a CTO can last. Initially, a CTO is for 6 months, then it can be extended for a further 6 months, and then for a year thereafter. The responsible clinician can only make a report for extension of the CTO if the initial grounds for the CTO still apply. Before the report can be made, the AMP must agree with the responsible clinician that the CTO needs to be extended. The assessment of the patient for the purposes of a decision as to whether the CTO needs to be extended must take into account factors such as risk, past history, home circumstances, and previous concordance to the conditions of the community treatment order. A community treatment order may also be suggested by a tribunal when the patient makes an application for discharge. A patient may appeal against their CTO, the same as they can appeal against when they are detained under the Mental Health Act, except for sections with the restriction order added to them. At any time, they may request for the hospital managers of their responsible hospital to end their supervised community treatment. The patient's nearest relative may tell the hospital managers that they want a patient's supervised community treatment to end. If they do this, the community treatment order will end within 72 hours unless the responsible clinician writes a report stating that they may be a danger to themselves or others if they do not continue having supervised community treatment. The patient may also apply to a mental health review tribunal during each period they are under a CTO. So this is in the first instance, in the first 6 months and the second 6 months, and then it will be each year thereafter. The nearest relative may also apply to the Mental Health Review Tribunal within 28 days of the responsible clinician writing a report stating that they are not happy for the hospital managers to stop the CTO within the time frame that the nearest relative requests the hospital managers to do that. A patient may be recalled to hospital for the following reasons. 1, if they breach either of the mandatory conditions, which are making themselves available for examination for the purposes of extending the CTO and making themselves available for the second opinion appointed doctor to see them and review their medication plan and their consent to treatment. The second is if the patient requires admission to hospital for treatment of his or her mental disorder, and that there would be a risk of harm to the health or safety of the patient or safety of other people if the patient is not recalled to hospital. Breaching any of the conditions on the CTO are not mandatory, do not necessarily mean that the patient needs to be recalled to hospital. However, this will be taken into account when considering whether the patient needs to be recalled for treatment of their mental health condition, for their health, safety, or safety of others. The recall to hospital lasts 72 hours, and during this time, the responsible clinician and the approved mental health practitioner need to decide whether the patient's CTO is revoked and they remain in hospital under Section 3 of the Mental Health Act, or the patient can be discharged back to the community on their CTO. The patient can be discharged from their community treatment order by the responsible clinician at any time. Thank you for listening. Hope this has been useful. Bye for now.